I'm Megan Coilwright, and I've been the editor of CardioSmart for the last 4 years. And I'm so excited to have Yet Lee join me in this conversation today about both the past, the present, and the future of this really important aspect of the American College of Cardiology. As a structural interventionalist, I truly believe in the power of the care team, and I'm excited to have Viet join us as a physician associate and leading the CardioSmart editor position to follow. And Viet, thank you for joining me today.
Thank you. These are big shoes. So I had a long legacy, at least 10 plus years that CardioSmart has been around. And I'm just grateful to be part of this.
You're right. CardioSmart has been around for a long time, and there is a bit of a misconception that the tools and the programs that are focusing on the patient voice at CardioSmart are designed just for patients. And you and I are so excited about how actually the tools have transformed our own practice. We see shared decision making mentioned in the ACC guidelines over and over again, and in fact, highlighted from other stakeholders like payers, both CMS and private insurance, really leaning on clinicians of all types, structural interventionalists, our APP community, really working together to ensure we have patient engagement. And CardioSmart actually is for us as clinicians to give us the tools of the how to for shared decision making. But still, there are a lot of folks that aren't sure how to bring it into their practice. Whether it be as simple as downloading some of our color infographics for patients to look at before we come in the room. So, for example, I'm not explaining what is aortic stenosis, but we can go straight to values and goals around the treatment of that disease process. But you've spent a lot of time working on other important ways for patients and clinicians to engage together in some of these complex topics, such as through the CardioSmart 360 app. I wonder if you could tell us a little bit, how do you implement that in your practice?
Yeah, the CardioSmart 360 app, just so folks know, is on your phones, but also there now is a URL that you can use on your laptops, desktops, right in the room with patients. So if you don't want to look at a smaller screen, but it's been fantastic to be able to actually draw on. It's very interactive, and you're able to draw on the heart itself. For example, if you're teaching about stents or bypass, or where a patient has had coronary lesions. It's eye-opening, and they don't have to learn the jargon of what the left anterior descending is. They can just see it where it's at, and it actually is fantastic, because over time patients do learn what proximal, mid, and distal is when you let them join you visually in their own health journey. Along with that, though, there are other procedures that are within the CardioSmart app. So, for example, I'm not a proceduralist, but I can show them what MitraClip looks like. I can show them what TAVR looks like in stenting. And it's so fun to see what happens with patients as they watch what the procedure looks like while you're narrating, while you're talking about it, and you can make it personal to them. So it's very helpful, I think, not only to them, but to the staff that I show when we're using the CardioSmart app together.